class. My name is Carolyn Haskins, and the article I chose today for the current event was Frondert and the Medical College of Wisconsin Open Inclusion Clinic to serve the LGBTQ community. So I wanted to go over some information from the chapter before I got into the specifics of the article. So Chapter 11 was titled Health Services for Special Populations. And as the chapter states, certain population groups in the United States face greater challenges than the general population in regards to accessing timely and needed healthcare services. So listed here are the different special populations that the chapter covered. And what I'm going to try to focus on is HIV and AIDS, and then kind of expand on that a little bit more with my article. So to provide some information that the book outlined for HIV and AIDS, rates have been declining since 2005, and these rates are in regards to new cases of HIV and deaths due to HIV and AIDS. And a lot of this has been seen to be due to new treatments. However, alternatively, so therefore people living with AIDS will increase because not as many people are dying. However, it's still a public concern, a public health concern among Blacks, Hispanics, and minority women. In 2014, males and Blacks continue to have higher rates than females and whites, and these racial differences probably reflect social, economic, behavioral factors. So there is still a need for continued research on preventing the spread of HIV, as well as preventing the development of symptoms from HIV to AIDS in these HIV-positive individuals. So, HIV-positive people may experience discrimination in access to healthcare. Recruits that test positive cannot join the military, the book stated. So, increased knowledge about HIV and personal contact with people who have HIV has improved the attitudes of healthcare providers towards individuals with HIV, and this exposure has contributed to their willingness to care for people with HIV. So when training healthcare providers, of course, you need to provide the medical and the treatment-related information, but also to have a more effectively trained healthcare professional, it's important to also focus on developing interpersonal skills, working on good communication skills, the ability to establish rapport, ask questions to these patients and listen, and then providing positive attitudes and respect and trust. So really trying to incorporate principles of holistic care. So to get into the article, so more than 100 specialties are available in the field of medicine, but very few focus on the LGBTQ community. So to outline what that stands for, if some of y'all don't know, it's lesbian, gay, bisexual, transgender, questioning, and queer. And LGBTQ community health centers operate in only 37 of 50 states, and not all of them offer the full comprehensive services that they need. So there are, in this population does have health disparities. There's just a lack of access, or maybe previous negative experiences that the individual themselves had or a friend had that keep them from seeking routine medical services, and avoiding care can lead to long-term health consequences. So to change that, Frondert and the Medical College of Wisconsin in Milwaukee opened the Inclusion Health Clinic this Monday, the 16th, and it is the first in the region to offer outpatient program with a full range of healthcare medical services in the LGBTQ community. So this healthcare clinic was opened striving to improve the health of this special population, the LGBTQ community, trying to provide a space where they feel comfortable, safe, and welcome, as well as provide the expertise needed to improve the overall health and outcomes of this community. So within the article, they interviewed the medical director of the Inclusion Health Clinic, Dr. Andrew Petrol. And in the interview, he described the current status of healthcare for the LGBT community and in regards to why this population often stays away from routine care. So there was a wide variety of reports, of course, ranging from good to bad. But on the lower end, there were some reports that transgender people reported being treated in a physically abusive way, or just maybe not knowing where to seek medical help, or not having access to all components of the care that they need. And Dr. Patrol also discussed that there is a lack of uniform policy to protect from different types of discrimination for this population. So the way that this health clinic is different is they are working towards trying to provide a non-discrimination environment and to offer all services that this community needs. And so they are working to train the employees to help provide non-discrimination. And he also even discussed that during the standard 4 years of medical school, on average, only about 5 hours are spent on health for this LGBTQ community. So there's definitely a need for improvement. So there is certain health conditions that are more prevalent in this community, and so LGBTQ community needs more preventative care and specialized screenings that maybe are not as often given to the general public. So vaccines that were mentioned, hepatitis A and HPV, are more commonly needed in this community. And there are higher rates for STIs, STDs, and HIV. So screening for those more often. And then just also they have elevated risk for cardiovascular disease and even certain cancers. So the Inclusion Health Center, trying to make themselves different and more specialized. They're training their staff differently. Well, but even some just have years or decades of experience providing for the LGBTQ community. Otherwise, they do provide standardized training, but on top of that, they brought in specialists to have one-on-ones with the staff, trying to provide that extra level of training that I mentioned earlier, working towards improving communication, knowing how to listen, and just providing trust to create a more welcoming environment. So they offer a variety of services. The OBGYN, comprehensive primary care, hormone therapy for transgender patients, HIV medication for prevention and for treatment, endocrinologist, and psychiatric care. And they also stated that most insurance plans are accepted. So, although the LGBTQ community as a special population wasn't specifically covered in the chapter, it does encompass the HIV and AIDS section of the chapter, and it helps to open a dialogue for this emerging group in the United States and even for the world. It's important to make this community feel welcomed in healthcare facilities and included in the medical field. It is also important to ensure that the LGBTQ community is properly examined and receives complete care. So the opening of this inclusion healthcare facility in Milwaukee, Wisconsin really does set a good example for the rest of the nation. And I hope that more facilities in this area, more facilities are in the process of being opened that are like this, or maybe that this opening inspires other medical centers and other universities to expand and offer this type of specialized medical care. So hopefully with time, people in the LGBTQ community will see an increase in access to healthcare that fits their specific needs, and then maybe eventually reducing rates of certain health disparities. So by having access, hopefully they feel more welcomed and seek more routine medical care. So with that, I kind of just came up with 2 questions to help get the dialogue moving. So how do you see the future of healthcare for the LGBTQ community? And do you think offering this type of care will encourage more to seek healthcare services? Thank you so much for watching. I look forward to reading your comments and answering any questions that you may have. Thanks so much.